Hi, I'm Krystal Alpeche, the training officer of the nursing department. Welcome to your in-service education session on proper hand hygiene, aseptic technique, and vital signs monitoring, accurate measurement, and interpretation. Today, I will be using a demonstration-based teaching strategy to help you learn and apply the key principles of hand hygiene, aseptic technique, and vital signs measurement. Mastering these skills ensures the safety of our patients and strengthens the confidence as you begin your nursing journey. So let's begin with our first session, the proper hand hygiene and aseptic technique. By the end of this session, you will be able to, number one, remember the WHO's 5 moments for hand hygiene. Two, understand the importance of hand hygiene in infection control. 3. Apply proper hand washing. 4. Analyze when a septic technique is required. And the last, evaluate your hand hygiene practices using a checklist. Hand hygiene is the single most effective way to prevent spread of infection. Studies show that 1 in 25 patients get healthcare associated infection every day. With proper technique, we can protect our patients, our colleagues, and ourselves. The WHO recommends performing hand hygiene at these 5 key moments: before touching a patient, before clean or aseptic procedures, after body fluid exposure, after touching a patient, and after touching patient surroundings. Let's go through the steps of proper hand washing. First, wet hands. Just let the water run to avoid touching the top later on. Apply soap and scrub all surfaces for at least 20 seconds. Back of your hands, your palms, back of your fingers, your palms, tip of your fingers, and your wrists. Rinse your hands and dry with clean towel. This technique prevents the introduction of pathogens during invasive procedures. Now, I am going to don the sterile gloves. Note the careful handling to avoid contamination. Also, ensure that your sterile field is never left unattended and remains above the waistline level. So first, let's pull it open through its edges. I will glove first my dominant hand, which is my left hand, by touching only the cuff of the sterile glove. Gently roll over the cuff. Now, this part is the sterile. I have to touch only the sterile part of the right glove. So I have to slide my left hand underneath the cuff to avoid contamination. And slide my hand gently. So now I'm ready for the procedure. Let's recap. Know the 5 moments of hand hygiene. Perform hand hygiene correctly. Use aseptic technique during sterile procedures. Practice regularly and reflect using a checklist. Let's protect our patients and each other. Thank you for your attention. Let's have a break for 5 to 10 minutes, and then we will be having our second session for the vital signs measurement. Hello, welcome back to our in service education second session. Monitoring vital signs is a foundational clinical skill that directly impacts patient safety and care outcomes. Using Bloom's taxonomy, our learning objectives will be: list the normal ranges for temperature, pulse, respiration, and blood pressure in adult patients. Explain the significance of each vital sign and how deviations can indicate underlying health issues. Demonstrate the correct technique for measuring each vital sign using appropriate equipment. Identify common errors in vital sign measurement and describe how to prevent them. Interpret a set of abnormal vital signs and determine the appropriate nursing response. Review the normal ranges for adult vital signs. For the temperature, 36.5 to 37.5 degrees Celsius or 97.7 to 99.5 degrees Fahrenheit. For the pulse, 60 to 100 beats per minute. Respirations, 12 to 20 breaths per minute. Blood pressure, 90 over 60 to 120 over 80. Each vital sign provides important information about a patient's physiological status. For example, a high temperature may indicate infection, while a rapid pulse can signal pain, anxiety, or cardiac issues. Deviations from these ranges can be early warning signs of deterioration, so accurate measurement and interpretation are critical. Now let's have the demonstration. I will be using a thermometer, a sphygmomanometer, and a watch with a second hand. So first, let's take the temperature of the patient. Ensure that your thermometer is clean. We can use an alcohol swab to clean the thermometer. Now, I am using an axilla thermometer. So we need to place this under the armpit of the patient. We will wait until the thermometer will beep. While waiting for the thermometer to beep, we will be taking the pulse rate of the patient. If his beat is regular, we will be taking 30 seconds multiplied by 2. If the patient's beat is irregular, we will be taking 1 full minute. So, let's palpate the radial artery of the patient. In taking the respiration rate of the patient, we need to observe the rise and fall of the patient's chest discretely for 1 full minute. Now I am going to take the blood pressure of the patient. Ensure that the cuff is at heart level and 2 finger breadths above the arm fold. I'm going to turn on now the sphygmomanometer to measure the blood pressure of the patient. So common errors in taking the vital signs of the patient will be: first, not allowing the patient to rest before taking the vital signs. Also, not using the appropriate size of the thermometer, sphygmomanometer, or miscounting the pulse rate of the patient. So always double check the equipment and the technique that we are going to use in taking the vital signs. Let's apply what we've learned with a case scenario. You are caring for Mr. Ronald, a 37-year-old patient with the vital signs of temperature 38.5 degrees Celsius, pulse 110 beats per minute, respirations 24 breaths per minute, and blood pressure 88/54. What could these findings indicate? What should a nurse do next? These findings suggest possible infection and shock. The nurse should immediately report these results, initiate appropriate interventions, and monitor closely. Now, imagine Mr. Ronald also reports feeling dizzy and has a pale, clammy skin. This additional information confirms the urgency prompt action is critical. Let's reinforce your learning with a quiz. Number 1. What is the normal adult respiratory rate? Number 2. Name one common error when measuring blood pressure. Lastly, if a patient's pulse is irregular, how long should you count? To recap, accurate vital signs monitoring is essential for patient safety. Remember to use the correct technique, recognize abnormal findings, and respond promptly. Please review the procedures regularly and don't hesitate to ask questions or seek clarification as you practice. Before you go, complete the evaluation form to share your feedback. Thank you for joining me today. Keep practicing, and you'll build confidence in this vital skill.